the endotheliopathy and sort of the hypercoagulability of patients and sort of managing that during the ongoing COVID-19 pandemic has been a topic of interest. But this is one of the first pieces of research or published articles I've seen to really sort of confront the issue and what it means for women's health in particular.
Yep.
So, could you sort of bring me through what the top points of your article were and what you hope clinicians could take from it when they're reading it?
Yeah, so I think the first thing is that, as you mentioned, that there's this marked increase in risk for blood clots of various kinds in patients with COVID-19. And we're just getting to understand the mechanisms of that. At the same time, for decades, we've known that there's an increased risk of blood clots in various situations in women with high estrogen levels, particularly pregnancy, birth control pills, and even hormone replacement therapy. And of course, those three things are really common with women. So the question arises is, are women who are pregnant or taking estrogen compounds at particularly high risk for blood clots when they also contract the COVID-19? So is there some interface between these two sets of risks? So that's kind of the question that's being posed. And as you know, it sounds like you follow this pretty closely, that that every week something new comes out. As we were submitting this for publication, we kept having to change the bibliography. But so we don't know much. We know about these what looks like some endothelial effects, maybe some platelet effects. So we don't know much about the mechanism of the COVID-19 thrombotic events. And surprisingly, after decades, we don't know much about the mechanisms of blood clots with pregnancy or birth control pills. So since we're working off of, so there's one set of questions for clinicians and one set for researchers, and the research topics we kind of outlined in the article. But for clinicians, I think, who take care of women, that have to keep a close eye on what's emerging in the literature to answer the questions of, if you have a woman patient with who develops COVID-19 and she's on birth control pills or HRT, should she stop for the time being? Or if she can't stop the birth control pills because it's not safe, should she get low molecular weight heparin? Okay. And then also for women who are pregnant who can contract COVID-19, should they receive low molecular weight heparin or regular heparin while we're waiting to understand the potentially compounded risk? So that's a long answer for you. It's and the kind of the tail end of that is that until we understand this better, that the physicians should be aware of their professional association recommendations as well as their local hospital recommendations.
Okay, thank you for that. And your last part of that answer really sort of leads well into my next question. For our listeners or our viewers that may be practicing clinicians, do you think that this sort of the potential risk that is brought on by taking birth control, oral contraceptives, or estrogen therapy, do you think that's something that physicians should be discussing with their women patients in regard to COVID-19 now? Or is this something that we need to further research before sort of putting that in a patient's ear?
Oh, I think it's absolutely okay to discuss now, understanding that we don't know yet if there's a compounded risk or not. But the fact that that risk may be out there, that if you can safely, if you contract COVID-19 and you can safely stop birth control pills for a time being, then that option should be at least discussed. Yeah. I don't think that all women should stop birth control pills in case they get COVID-19. Yeah.
Article, the commentary that you put together, you pose a lot of questions sort of at the end. Do you think that the research that's going on now will be able to sort of answer those questions? Or do you think that more resources need to be dedicated to researching this topic?
Yeah, not surprisingly, more resources need to be dedicated because we just, it's been just in the past few months that we even know this is an issue. So there has not been much time to organize research, get it written up and funded. So I think we're in the really early stages, and this deserves, considerably more resources than are being devoted right now.
All right. And now, was there anything else you wanted to add about your study that I might not have asked you about, or you think is important for people to take away when looking at it?
No, I kind of included everything in that first statement, and then,
Yeah.
and that last question you asked, I thought was a really good question. Yeah.
Thank you. Yeah, it's definitely, just because I have to ask, I also cover cardiology, and I know there's a lot of trials examining the use of ACE inhibitors and ARBs, and there's a lot of ongoing trials looking at that and whether or not discontinuation could help or harm a patient. But after looking at your trial, or after looking at the commentary that you guys put together, I couldn't find any particular trials being organized to look at the direct effects of stopping birth control, continuing it during COVID-19, or in patients that had already contracted COVID-19. So I just wanted to sort of pick your brain. I know you're a bit more involved in the research than I am, but
And
definitely seems like something that's under-researched at this point.
yeah, and in that sense, also, I think at least as important, if not
Mhm.
more important, is understanding the comorbidities of COVID-19 in pregnancy. I think, um, so research in these interfaces with pregnancy is also extraordinarily important.